Imagine half of men over 50 have erectile dysfunction, all because of neglected pelvic floor muscles. Maybe you are one of them. On Reddit, a 56-year-old man complained, "Blood to my glands is poor, full but flaccid like a stress ball. I used to think it was just age, until my friend John told me 4 weeks of Kegels, and my life has completely changed." If you're a 50-year-old man, listen up. The muscles you ignore can be detrimental to your confidence, intimacy, and even domestic happiness. Most men believe that declining erectile function is a natural part of aging, but data shows that's only part of the story. What actually happens starts with a slowdown in circulation. When blood vessels lose elasticity with age, blood flow to the penis is no longer optimal. Erections become slow to appear, don't fully harden, or are difficult to sustain. Then, there's testosterone. This hormone plays a role in arousal, energy, and overall vitality. After the age of 30, a man's testosterone levels drop by about 1% per year. By their 60s, many men have lost almost a third of their initial levels. But erections are not just a matter of vessels and hormones. The central nervous system also plays a crucial role. Visual stimulation, touch, or even erotic thoughts need to be responded to by the brain and sent through neural pathways to the muscles and blood vessels. The problem is that this process slows down over time. Responses are no longer spontaneous, or they don't happen at all. Add common diseases like diabetes, hypertension, and high cholesterol. They worsen the condition of blood vessels, lower nitric oxide, and inhibit arterial dilation, the basic mechanism for an erection. But underneath it all, there's one system that hardly ever gets mentioned in men's health conversations: the pelvic floor muscles. These muscles support the prostate, bladder, and penis. They are tasked with maintaining blood flow pressure to the erectile tissue, maintaining strength and direction. When these muscles weaken, it's not just erections that suffer. Urinary control, orgasm, and even self-confidence also suffer. The problem? Hardly any men ever train them. Not at the gym, not at home, and not even when advised by a doctor. But once this muscle is trained properly, the results can be staggering, and that's what we'll get to shortly after. A research room at Nuffield, where dozens of men in their 60s gather every morning. They filled out the IOEF questionnaire, recorded erection frequency, and followed a pelvic floor muscle training protocol. 3 months later, 40% of them reported erections back to normal. Their IOEF improved by an average of 6.7 points. The numbers bust one of the biggest myths. The key to intimate vitality is not just hormones, but the pelvic floor muscles that have been overlooked. Why are pelvic floor muscles so important? When men neglect their pelvic floor muscles, the impact is not immediate. But like an unrepaired brake leak, the damage slowly spreads throughout the system. The first impact is usually urinary incontinence, small leaks when coughing, laughing, or sneezing. This is not only a medical problem, but also a social one. Many men begin to avoid meetings, long trips, and even intimacy. Second, of course, erectile dysfunction. Without the strength of the pelvic muscles to properly compress the vessels, blood is not retained for long in the erectile tissue. The result? Weak, brief, or even no erection at all. Third, a decrease in orgasmic sensation. Many men over the age of 60 report that their orgasms feel dull or empty. In many cases, this is due to the weak contraction of the bulbous spongiosus muscle, a small muscle that provides the drive during climax. Fourth, there is discomfort in the pelvic area, like a sensation of fullness, heaviness, or pulling. Some describe it as sitting on constant pressure. This is a sign of muscle imbalance, especially when posture is poor and basic muscles are inactive. But the most hidden and most often underestimated impact is on mental health and relationships. Many men over the age of 50 begin to withdraw from their partners due to embarrassment, frustration, or loss of confidence. On a Reddit forum, one man wrote, "I can accept hair loss, weight gain, even sore knees, but when I can no longer feel physically connected to my wife, that hits the hardest." And all of that is rooted in a muscular system that is never seen, never noticed, never trained. But good news, this damage can be reversed, not with pills, but with a simple, scientific, and consistent approach, which we'll discuss from now on. Before diving in, We should know what are the habits that are slowly damaging our intimate parts. Without knowing this, even after doing the exercises, you'll be back to square one where frustration surrounds you in bed. Erectile dysfunction is often thought of as a sudden condition, when in fact, it's an accumulation. Every day, our bodies keep a record. The way we sit, eat, move, breathe, and sleep, all of which make up the foundation or downfall of our circulation. And circulation is the foundation of an erection. Let's take a look at the 5 habits that most often damage this system, silently, every day. First, sitting too long. Sitting for more than 6 hours a day is proven to decrease the heart's efficiency, slow blood circulation, and cause chronic pressure in the pelvic floor. This reduces oxygenation and nutrients to erectile tissue. Try, if you feel that you have been sitting longer, get up to just walk to drink water or breathe fresh air outside. It will help improve blood circulation, especially blood circulation to the pelvis. Second, a diet high in saturated fat and sugar. Processed foods, fried foods, and sugary drinks accelerate plaque buildup in the arteries. This narrows the blood flow pathways and decreases the production of nitric oxide, a key molecule that relaxes blood vessels when aroused. Replace high-fat and sugar foods with fruit snacks or roasted nuts, just to fill the belly, and don't indulge, because there is no limit to that. Diet will be difficult if there is no self-awareness. Third, smoking and alcohol. Smoking damages the endothelial lining of blood vessels. Excessive alcohol lowers testosterone levels, interferes with nerve signals, and lowers stimulation sensitivity. Replacing alcohol with water will be very difficult at first. But think of it this way. If you've gone a whole day without alcohol, imagine your sacrifice going down the drain if you take one sip the next day. Fourth, lack of sleep. Less than 6 hours of quality sleep decreases the production of reproductive hormones, raises cortisol levels, and disrupts the nitric oxide cycle. If you often have insomnia, you can use the 4-7-8 breathing technique. 4 seconds inhale, 7 seconds hold, and 8 seconds exhale slowly. This method is proven to relax the body and mind, so that it gives rise to a sense of sleepiness. Also avoid blue light 2 hours before bedtime. Fifth, chronic stress. Whenever you are stressed, the body diverts blood from the reproductive organs to the large muscles and brain. It's a survival reaction, but if it continues, the body considers the sexual system a low priority. Surprisingly, all of this is connected. Stress disrupts sleep. Lack of sleep makes you seek fast food. Sitting too long makes you lazy to move around. And in the end, you lose control of something that once felt natural. But it doesn't have to end there. Because just as habits can shape problems, they can also shape recovery. From now on, we'll get into the heart of the solution. The 4 most effective exercises for men over the age of 50 to restore circulation, strength, and intimacy. Before starting a workout, it is important to understand how the pelvic floor muscles contribute to sexual function, so as not to be misguided. Brief anatomy. The pelvic floor muscles form a sling from the pubic bone to the sacrum. Major muscles include levator ani, supporting the bladder, bowel, and reproductive organs, ischiocavernosus, and bulbospongiosus, which compress the dorsal veins of the penis to maintain an erection. When an erection occurs, the pelvic muscles contract to resist the backflow of blood, creating an internal pressure that holds the blood in the corpus cavernosum. Without this muscle strength, blood quickly flows out, making the erection weak and unstable. Clinical studies support this role. Gupta et al., 2015, in the International Journal of Impotence Research, found that men who exercise their pelvic floor muscles regularly experience significant improvements in IOEF scores and ejaculation control. Grant et al., 2002 showed, in a randomized controlled trial, men with a Kegel program for 3 months saw improved erectile function and reduced incontinence compared to a control group. Harvard Health Publishing asserts, pelvic floor muscle contractions increase the production of nitric oxide, a key molecule that relaxes blood vessels during sexual stimulation. The Mayo Clinic recommends these exercises as the first non-pharmacologic intervention for erectile dysfunction and incontinence in men age 50 and older. The American Urological Association, 2024 adds, minimal risk and low side effects make pelvic floor exercises a safe choice for post-prostatectomy to elderly patients. with mild to moderate ED. In other words, the pelvic floor muscles are the bridge between nerve signals, hormones, and blood vessels. Strengthening these muscles not only helps achieve an erection, but also sustains it for longer and improves the sensation of orgasm. This in-depth research makes one thing clear. Without pelvic floor muscle training, other efforts, whether pills, supplements, or hormonal therapy, only provide a partial solution. This is why the full workout program we'll review next. 4 simple yet impactful moves. Once you understand the root of the problem, circulation, hormones, nerves, and weakened pelvic floor muscles, it's time to act. In the next few minutes, you will learn 4 simple exercises that you can do anywhere. These exercises are designed to strengthen the pelvic floor muscles, improve blood flow, and increase erection control and strength. No need for expensive equipment. Just get to know your body, follow the instructions, and feel the changes in a matter of weeks. Clinical instructors recommend 2 sets, x 10 reps morning and night for optimal results. Let's start with the first exercise. 1. Standing Kegels. Start in a standing position. Feet shoulder width apart, knees slightly bent, and back straight. Pull your pelvic floor muscles, as if you were holding back the flow of urine, without holding your breath or tightening your abdominal and buttock muscles. Hold the contraction for 10 seconds, then relax for 5 seconds. Repeat 10 times for 1 set. Do 2 sets in the morning before breakfast, and 2 sets before bed. The benefits of standing Kegels help increase muscle awareness, initiate recruitment of the largest pelvic floor muscle fibers, while improving posture. Common mistakes are using your abdominal or glutes, holding your breath, or doing the movement too quickly. Make sure only your pelvic floor muscles are working. 2. Seated Kegels. For the seated variation, choose a sturdy chair without armrests. Sit up straight, shoulders relaxed, body weight evenly distributed. Pull the pelvic floor muscles up and in, imagining you are rolling the pelvic area. Hold for 5 seconds, then release 5 seconds. Do 3 sets, curse 15 reps. Best time during work breaks or waiting for coffee. The benefit of seated Kegels is that it focuses on muscle control under static load conditions. In addition to strengthening the muscles, it trains neuromuscular coordination. While the body is seated, a common posture that men 50 years and older do most often. Never lean back, use the lower back muscles, or release the contraction too quickly. Make sure movements are smooth and isolated. 3. Supine Kegels. Lie supine on a mat, with knees bent and feet flat. Place your hands beside your body. Pull the pelvic floor muscles, as if lifting a small ball, lifting it slightly off the mat. Hold the contraction for 10 seconds, then release slowly for 10 seconds. Repeat 10-12 times for 1 set, 3 sets total. The lying position eliminates the burden of gravity, making it easier to isolate the muscles. Supine Kegels are effective for beginners and those with very weak muscles. Avoid using the abdominal muscles, thighs, or buttocks for lifting. Make sure only the pelvic floor muscles move. Focus on steady breathing. 4. Walking contractions. After understanding static contractions, take the exercise to an everyday activity, walking. As you walk in the house or park, pull the pelvic floor muscles inward to about 50% of maximal strength. Hold for 1 step, then release slowly on the next step. Take 10 consecutive steps, rest briefly, then repeat 5 times per session. Try 2 sessions a day, morning after waking up and evening before dinner. Walking contractions integrate pelvic floor muscle strength with functional movements, improve coordination, and stimulate blood circulation to the pelvic area as the muscles work in a dynamic rhythm. Never tighten muscles too hard to 100%, thereby impeding blood flow or not controlling breathing. Keep a balance between contraction and relaxation. Those are the 4 simple yet highly effective exercises: standing, seated, supine Kegels, and walking contractions. Do them consistently, and your pelvic floor muscles will return to strength, support healthy blood flow, and improve erection control and strength. To make these exercises easy for you to follow, we have prepared a PDF guide, 4 pelvic floor exercises for men, 50+, which can be downloaded at the description. Inside there are step-by-step instructions, daily schedule for 12 weeks, progress checkbox for each set, notes space for your feelings and results. Use this PDF as a personal trainer. Tick off each exercise when you're done and see your circulation and confidence change. Download link is below. Don't delay. Start recording your progress today. Disclaimer: this workout is educational and does not replace professional medical advice. If you have a heart condition, hernia, post-prostate surgery, or other serious health issues, please consult your doctor or physiotherapist first. Now, let's hear a real success story that proves the power of this exercise. John, 58 years old, an executive who lost confidence after several years of weak erections. He regularly performed standing Kegels and walking contractions for 12 weeks. The result: John's IIEF-5 score rose from 12 to 20, returning to the normal erection zone. He reported more stable energy, better sleep, and increased intimacy with his partner. Robert, 65 years old, had mild incontinence post-prostatectomy. Robert incorporated seated and supine Kegels into his daily routine. Within 8 weeks, urine leakage was reduced by 75%. He resumed short-distance running, and his sexual confidence was restored. David, 72 years old, an active senior who exercised lightly but forgot about pelvic muscles. After following this 4-exercise program 4 times a week, David noticed a 25% improvement in blood flow on ultrasound Doppler examination, as well as a reduction in the heaviness in his pelvis that once interfered with his hobby of gardening. More so, a 2024 survey in one online community involved 150 men aged 60-80. 85% reported improved ejaculation control. 60% felt more intense orgasms within 3 months. 70% noted longer-lasting erections. And these aren't just numbers. These are real stories that allow men to restore quality of life. Fitter in daily activities. Mood stable as hormone balance improves. Emotional connection with partner warms as confidence is restored. Remember, your body is very responsive when given the right stimulus. Just like biceps muscles that grow after a hard workout, pelvic floor muscles also demand consistent training, minimum 5 times a week, to show real changes. Ultimately, it's not about age, but about choice. Will you let your muscles be neglected, or train them and feel the transformation from the inside out? Join hundreds of other men who have taken this simple step. Make 4 pelvic floor exercises part of your daily routine, and watch how it restores your energy, intimacy, and confidence. Thanks for watching. If this information helped you understand the importance of the pelvic floor muscles, hit like, share this video with a friend or partner in need, and write in the comments which exercise you will start today. Don't forget to subscribe and activate the bell so that you don't miss the follow-up series on elderly exercises and other health tips. See you in the next video. Stay healthy, fit, and confident.